Word in the clinic is concussion. And so I'm a little concerned because it's football season and I have had a couple of patients that I've diagnosed with concussion, and that's pretty concerning. And so I think it's a perfect time to have that discussion with football season around. And it's just not football, it's other sports as well. Any type of contact sport and other things that can happen in our lives can give us a concussion. So we definitely need to be aware of what that looks like. How do you know if your child has a concussion? And if what do you do about that? How do we manage that? And we always try to keep these short, so I won't be able to go into all the details, but definitely want to have this talk. I'm trying to see if usually I can see you guys popping up, but I'm not seeing anybody right now. Maybe there's no one there. Okay. Anyway, if you have any comments, please send them over. I'm not seeing anything right now, but maybe there's something different. But anyway, let's get started. So, a concussion. What is a concussion? So, it's a mild traumatic brain injury. And oftentimes it's caused by a direct hit or blow to the body or head. But also it can be not direct, it can be indirect in a sense where the body receives some force that was so great that the brain inside of the skull rattles back and forth. So oftentimes you don't see that hard hit on the football field that everyone goes, oh, like a big hit. It might have been someone downfield. They just got a hard hit to the body, but the brain rattled in the head. So there's a really a big force that causes it, whether it's direct or indirect. And so what happens, the brain is injured and there's a release of chemicals and there's damage to brain cells. And so this is very, very serious. And that is what a concussion is. Hey there, can you tell who you are? Hey, Bianca. And so the way a patient or a child, your child would look if this happens to them is hopefully they would know that they got hit pretty hard and they feel that impact. And oftentimes that person will immediately feel a headache or dizziness. Sometimes people are hit and they lose consciousness. They get knocked out. So there's different degrees of severity. Hey, Malia. And anywhere from mild, moderate, severe. Some people don't manifest their concussions like the two people that I saw. It wasn't noticed until a couple of weeks later and they presented with headache to their parent and they brought them into the clinic. So it can be a sudden onset, hey Vonda, or it can be something more gradual that's more hidden and you don't pick up on it. So that's what we want to talk about. What are the things you don't want to miss? A child can immediately, like we said, it can be obvious. They can be knocked out. They can have a seizure. It can be sudden damage. That's obvious. They're going to go by ambulance or to the emergency room, right? Hopefully that will happen. You don't say, oh, he woke up, now go back play. We're not doing none of that, right? So, but for some kids like these particular patients, they felt the impact. They knew it was a tough hit. They felt a headache, but they pushed through and they kept playing. That's a no-no. We're going to talk about that. And then for weeks, up until coming to see me, they kept having that persistent headache. Coming and going. Parent was giving them headache medicine, but it just kept being there. And oftentimes the child can feel confused, have nausea, vomiting. They're just not clear in their head. There's a fog there. There can be visual problems or changes, speech changes. The mood can be off, angry, irritable. They feel just bad. I feel sick, but it's related to that fog or just feeling different. They can be more sleepy, sleeping a lot or sleeping less, not getting the sleep that they used to. The coordination or the gait or your walking, your balance can be off as well. And so these are all neurologic signs from the brain that something is wrong and you need to be able to pick up on that. Hey, Carlos. So if your child is playing any contact sport, from soccer to football to boxing, if they're a cheerleader and they fall off the top of a pyramid, if you're in a car wreck, if you get into a fight, I had a fall, anything happens where you hit your head or there's a sudden force and you feel like your head snapped back, or from the time that trauma happened, you have a headache or any of these other signs and symptoms that I just discussed, there could be a concussion. Okay, so think about that. And the next thing I want you to do is make sure you get seen by your doctor. So if your child is out on that field and you see something funny, they're not acting right, they start having headaches and they've been practicing, the games are going now. That's what happened with these students, practicing, playing games. It can happen at any point. And they had not recognized that they could potentially have had a concussion. Kids that's playing footballs for years and did not recognize that this could be a concussion. But when I asked, when did the headache start? Both of the patients clearly remembered during football after that hit, and we connected the dots. And they never were kids that had headaches before on a regular basis. So that's often the thing that makes the person remember, oh, it was when I fell. It was when I hit my head, or oh, when I got that really tough hit. Okay, so definitely hey Mark, you need to be aware if your child is playing contact sports, that you watch these things, you check in with them. If they start having symptoms that they usually don't have, headaches, you want to ask them, did you get a big hit? Do you remember this happening while you were playing? And then bring them in to be checked. We can't miss this, okay? Now, how do we make that diagnosis? Just like I said, having the discussion, getting the history, examining the patient, understanding what happened, and it's a clinical diagnosis. Now, there is oftentimes some testing we can do, not like a MRI or a head CT, but just questions, mental status, neurologic testing, cognitive testing to check memory and things of that nature to help also score and determine the level of concussion or severity. And your coaches and trainers should be able to do those types of things too. So one of my first points in protecting yourself and preventing this and treating it appropriately is your child recognizing that something's wrong, telling a coach or a trainer, coming off the field, stop playing, and that those individuals know about concussions and they can do an assessment on your child at that time and then send you to the doctor and you don't return to play until they're better. That's how it's supposed to go perfectly. Recognize, tell an adult, get the testing, come see the doctor, follow those symptoms to resolution, and then you may return back to play. And that scenario can go different for every individual as to how long it takes for them to totally heal and get back to play. And that's why some young people don't want to tell, because if they're the star player or the coach is dependent on them, or they just love their sport, they don't want to come out. They may see that as a sign of weakness. So we have to fix that mentality because your child's health and life can depend on it. You have to come out. You have to say, I'm hurt, no matter what the injury is. And you have to see your doctor and follow up to make sure you're okay to play. Don't put your child's health and life at risk, and make sure kids, don't lie about your symptoms. If you still have headache, if you're still nauseated, if you still feel dizzy, confused, and have all of these symptoms, if you're not back to your baseline, don't go back to play. It's just not worth it. Because you can have something called second impact syndrome, that you've had a concussion, you return to play too soon, your brain is already altered and damaged. It only takes another hit or some other injury or just the fact that the brain is not healed yet to create more damage in the brain that could affect your lifelong neurologic status, learning, cognition, everything. So we don't want to play with the brain, all right? So how we treat this, you're going to rest. This is what I did with the patients. Rest, stop playing. Okay, make sure you're getting sleep and hydration and proper nutrition. And yes, you can take Tylenol and Motrin for headaches or if there's something we can give you for some of the symptoms you may be having. But you're going to rest this out. You're going to stop playing the sport. decrease your chance of getting hit again. And we're going to have close follow-up until those symptoms have resolved. And you can't go back to play until those symptoms have resolved. And sometimes, based on whatever the findings are, if there are any serious neurologic deficits, you may need to see a specialist in the area of concussion management. So just wanted to tell you guys about that. Football season, sports are heavy right now, and a lot of sports have risk for, a lot of contact sports have risk for concussion, and you don't want to miss the signs of a concussion. You don't want to delay having your child seen and monitored and removing them from the sport and helping them to heal before they return. And that's the message for today. On my website, drcandicemd.com, there is my very first podcast episode with a sports medicine physician, and we talk about concussion. And she gives you a lot more tips and information on even finding the right team and the right coach. How do you know your child is ready to play? And also on my podcast, Kidding Around with Dr. Candice, I have episodes on sports clearances, pre-participation physicals to make sure your child is healthy to play. So we talk about kids collapsing on the field and having heart arrhythmias and things with their heart that we didn't know about. And so these clearances need to be done for children before they play any sports, so that we know they are healthy to play. And that evaluation will do probably the most complete evaluation that we have in order to make sure your child is safe to play. So we do have a podcast episode on that as well. So check those two things out. And that's all I have for today. Have a great weekend, and we'll talk next week, hopefully, with the word in the clinic.